Welcome, Flawless family. I am so pleased to be here today with four of my favorite colleagues to discuss a topic that's near and dear to my heart. Most of us on this panel have personal experiences on this topic of social isolation, older adults, and this age of COVID. So I will start by introducing the panelists. We have our Flawless board member, Mike Thompson, who is the CEO of the National Alliance of Healthcare Purchaser Coalitions. He's a national thought leader in business health strategies and health system reform. We have Sheila Hamilton, who is an author and a 5-time Emmy award-winning journalist. She's the CEO of Beyond Well, and her podcast, Beyond Well with Sheila Hamilton, is Spotify's fastest growing mental health podcast, so out. And Sheila also serves as a Flawless Advisory Board member and is always there to help us, and we're just so grateful to have her on our team. Jacob Cramer is the founder and executive director of Love for the Elderly. At 14 years old, Jacob did his first TED Talk, and he is also a full-time student at Yale University. And our moderator today is my dear friend, Donato Tramuto. Donato is the founder and chairman of the Tramuto Foundation and Healthy Villages. He is also an author and a TED Talk speaker. He is very involved with the Robert F. Kennedy Human Rights Organization, where he's on their board. He's the chairman of their center in Europe, and he is a Robert F. Kennedy Ripple of Hope laureate. So Donato, I will let you take it from here.
Thank you, Janine. And before we begin, we owe a great debt of gratitude to you for organizing this panel. I believe it was Dr. Martin Luther King who said, it's not the actions of the bad men that are appalling, it's the silence of the good. And we have to speak out more, and we have to rely on one another and the leadership that each person can bring to addressing the issues that are before us. So I really want to applaud you and the foundation for taking this topic on. And to the panelists, what an impressive background for each and every one of you. And I want to thank you for everything you're doing to make the world a more just and fair place. It's an honor to be moderating here today. And so I'd like to begin, a number of years ago, I wrote a book, and what I realized about the book was that everybody has a story. And my story is no better or worse than the next person's story. And I do think that that's part of why loneliness has escalated, is that we're not taking the time to listen to the story of each and every person. And so I always say nobody cares what you do until they know why you do it. And I would be violating my leadership mantra if I did not start off with the question, why is this topic of loneliness in the midst of this pandemic so important to you? And I'm going to first start with Sheila. Your mom, I believe, had COVID. And so maybe you can just share with the audience what that story really meant to you. Sheila?
Thanks, Donato. My mom is a really fiery woman. She's 83 years old, doesn't like to be told to use her walker. She was out every single night before COVID playing bingo and participating in all of the discussions, going on the field trips. She's unstoppable, and she refused to live with any of her kids because she wanted to be independent and allow us to have our families and our careers. When COVID hit, she was not really good at FaceTime. It really made her nervous, and she didn't like the whole technology aspect of it. So we got into this really wonderful groove where I would talk to her every day for a half an hour, and I would let her talk about her life and her memories and how she was doing and what it was like to be isolated. And on June 29th, I had a very concerning conversation with her because she sounded a little distracted and not feeling well. And then over the July 4th holiday, she became very, very ill. She had terrible gastroenterology problems. She had a severe headache and a really high temperature. And what I realized then was that in assisted living, there was no actual way to cope with a person who was much, much sicker than there was a person who just needed their pills given to them. And so I already ran into that kind of bureaucracy that plagued us throughout her care. Every day I would call her and she would be weaker and weaker. And then on July 4th, her COVID test came back. And that the next morning I spoke with her on the phone and she did not recognize my voice. She told me that she'd had my sister in her room all night long and that my sister hadn't allowed her to sleep. I knew she was hallucinating because no one was allowed to go in her room. And so we managed very quickly to get her taken to the University of Utah Hospital, where she was cared for 3 days, rehydrated. Because my mother didn't have the lung issues, she was sent home. But I will tell you, the experience of having a mother who was so cognitively sharp pre-COVID and then to actually cope with where she's at now has been completely devastating. Her neurocognitive ability is probably half of what it was prior. And she's severely weakened because of the long days of dehydration. So we ended up putting her in an apartment with a full-time caregiver until she can begin to get her feet back underneath her. And every day I see little gains, but I will tell you the most heartbreaking part of this for me is that I think I would have had a mother who lived to 100. And I have seen this disease and the way that she was treated during the disease take easily 15 years off of her life.
Sheila, our thoughts, our love, and our prayers are with your mom, and we really do pray and hope for a good recovery. Thank you for sharing. Thank you for sharing that story, Mike. I think your mom also had COVID-19. If you could share your story.
Yeah, my story is similar but different, I guess, in one sense. My mom had not been well. She probably since she was about 85, she had started to deteriorate, and she was 93. She had started in assisted living, had moved to a nursing home, and then at the end, we would go visit her, but it would be very limited what we could actually do with her. We would take her out if we could, or at least take her out in the hallway and talk with her and all that. And she would kind of light up when we were there, even though her cognition had suffered already on this. But then, like a lot of people in nursing homes during this COVID-19 pandemic, she became totally sheltered in, and to the point that no one could go visit. So my brother, who lived in the same town, could no longer go visit her, and he was basically visiting her every day. And we would go up at least every month, and if not more. And with that, I think what we found is basically we and she were isolated from each other in the last few months of her life, even before she was diagnosed with COVID. She was diagnosed with COVID, and literally within a week, she passed away. She never went to the hospital. We know that a lot of people here in the Northeast in particular have been in nursing homes, have been disproportionately impacted by COVID. And I guess the part that probably has been the hardest to understand or believe is that you don't have a chance to go see your mom in those last few months. That, one, it must be awful for her, and two, it's awful for you, right? And then, of course, when she passed away, the ability to do what one normally does when you lose a mother, you're not in the funeral home, you're not there. And frankly, what I ended up doing, and I think Janine knows this, is essentially working with my wife on a little eulogy that I passed around to all my friends just to describe my mother, and she had a great life. So what was ironic about my mom is that she was a nurse. She worked in hospitals all her life until around age 59, you know, a little younger than I am right now. And then she retired and took a position at the senior center as the nurse for another 20 years. And she would lead the exercise classes, and she would give shots and all that. I think they had a little grant from the state, and, you know, really, she really contributed to this community for many, many years. And unfortunately, I don't think those people either had the chance to honor her at the end either. So,
Mike, thank you for sharing that story. The loss of a parent is a sad event in one's life. I don't care how old your parents. I lost both of my parents 6 months apart. I'm also want to thank you for sharing the double whammy that comes out of this, and that is the inability to mourn with one another. Like you, I went to my first virtual funeral when Maeve and Gideon Kennedy tragically lost their lives in April, and there was a sense of loss that you couldn't be with one another. And so I could tell you, this panel right now, our hearts are connected to your hearts, and we thank your mom for having you on this earth. You're a gift to all of us. Janine, you also have a very similar story. Your mom went to Colorado, if I recall, and there was an outbreak at her facility, and I can't remember if your mother had COVID, but I know that there were quite a few of her fellow residents that did get COVID. You could share your story and what that meant to you during these last few months.
Yeah, so my mom has Alzheimer's. So cognitively, you know, there are many issues there, but physically, she's perfect. Absolutely perfect. No medicine runs around, like really, really great physically. She's like, Donato, we come from the same stock, you know, Italian immigrants, very strong. My grandmother lived to 96, like just amazing, amazing, healthy, physically healthy. So in her assisted living facility, there was an outbreak on her floor with close to 30 cases between the staff and the residents, and 6 people passed away. She did not get it, but she's in such a small town. She's in a tiny, tiny town that my family decided to move her. So she's now in Denver, where of course the medical care is better, but she's 3.5 hours away from any family. And the horror in it was that she was on quarantine for 4 months. So she was running around, but she was physically fabulous, and now she's in a wheelchair and cognitively much worse. And it's just, so the impact and the effects, you know, she didn't even get COVID, but the impact on her life is just so serious.
Well, Janine, I don't know your mom, but I've had the pleasure of knowing you, and the love and the high spirit that you give in terms of compassion. I can only imagine the persona that your mom represents, and we do hope that things go well for her. Jacob, a student activist, want to hear more about that. And as I stated at the beginning, he's the founder of Love for the Elderly. I love the name, Jacob, and I love the fact that you have recognized how important it is to stay in touch with seniors through letters. And so what has changed for you? You started this organization when you were 14, which I believe was like 5 or 6 years ago. And so a lot has changed in just the last 4 months. Can you give us your perspective on the world you see today and the value of getting connected with our seniors?
Absolutely. So yeah, when I was 13 years old, I had been volunteering in senior communities, and I realized that loneliness is a huge problem. And it definitely still is today. I think during this pandemic, we've all gotten a taste of how lonely and isolating it can feel to not be able to see our friends or family. And for people, as has been already discussed, who are experiencing this firsthand with like family members, that intense feeling of just overwhelming is heartbreaking and devastating. And it's also so important to think about the social isolation element that so many senior communities are experiencing right now, not being able to leave their rooms in senior livings, not being able to FaceTime because of lack of access to technology. All those things are really important. So this has been the work that I've been doing for the past 7 years, is connecting seniors through handwritten letters, which are written by strangers from across the globe. And this year to date, it's August right now, so we've collected over 40,000 letters and sent those to 586 senior communities, which is really exciting. And I think it just shows the kindness of the world right now. During a time when it's so much easier to think about ourselves, people are thinking about others and trying to support others during this otherwise very gloomy time. I personally have struggled during the pandemic with like social isolation. I know a lot of us have gotten a taste of it, and I just think it's so important to recognize that we should be embracing others right now, even if it is 6 feet apart.
Jacob, I'm giving you a Zoom hug. Thank you very much. You've touched not only 40,000 seniors, but you've touched many more and their family members. I was mentioning to Janine the other day that in addition to herd immunity, I hope we have herd kindness and herd compassion that comes out of this pandemic. So let me, if I may, I want to get into some questions, and thank you all for sharing your stories. As we look at the last few months, I'd like to frame this in the following manner. COVID-19 has had a disproportionate impact on a population that has been vulnerable, the minority and the older population. 15% of our population right now would be unable to put $400 together for an emergency fund. We've had the George Floyd situation, and all of these point to inequality. And yet, Article 25 of the Declaration of Human Rights states that healthcare is a basic right for every single person. And we now have this new chronic condition of the 21st century called loneliness. And it's not just impacting the elderly, it's impacting the young as well. And with what's going on with COVID-19, with what's going on with our social unrest, we've heightened the loneliness and this sense of isolation. And I want to just frame for the panelists that there are two types of loneliness. That which is social isolation, where because of where you live, you're just unable to connect. But then there is that true loneliness where you can be in a crowd of 100 people, and yet you feel alone. You feel that you're not connected, and you feel like your life is not relevant. And so now we have COVID-19 and the impact of mental health upon our society is going to be increasingly rampant. So what can we do? What do we need to do from a policy perspective, from a compassionate perspective, from a societal perspective? I don't know if I have the answer, and I don't think I do, but it'd be great to just kind of address this as a group here. And Jacob, what you're doing, one of the aspects of, writing letters, but one of the things that I've learned here is that it's not going to be about new innovation. It's going to be about innovation and integration. So let me kick that around. What can we all do without thinking that a vaccine is going to be the cure for loneliness? So Sheila, may I start, with you and your thoughts on that?
I love that question, Donato, because, and I'm just going to use the example of my mother. The immediate exercise that her assisted living went through was, here we have these FaceTime things for you. My mother has never been a technological person. She's been a very intimate, a very present, and a really compassionate human being who really loves deep connection. And so when we'd hold the FaceTime up to her, it would drop down to her neck and to her chest. She just wasn't into it. And yet, if I could call and talk to my mother and really ask her about what the experience of being alone was like, what television shows she was watching, what did she find humorous, how was her puzzle going, and really ask her deeply about how she was doing. It made her day. She said those phone calls of deep connection actually made her day. And so what I keep thinking is we keep trying to find technological advances out of this, but the only thing, Donato, that I believe is actually going to work is that very personalized, caring, compassionate time with other human beings.
Music to my hearing aids.
Oh, I'm glad to hear that.
Sheila, when COVID-19 started in March, I did something. Every single day I called one person who I had not spoken, and I still do it today, who I have not spoken with in years. And it wasn't because I had a disagreement with them, it's just that life got busy. And it was amazing what I uncovered. Yogi Berra once said, you don't want to make the wrong mistake. And I think these simple things is not just about technology. Who wants to pick up on that? Janine, what could you add to what Sheila indicated? Was it's sometimes simple, outreach calls. Janine?
For sure. And I've been doing the same. So what I've taken a lot of action. The grief on this and the heartbreak is so intense for me since, it's been 4 months now, that I have taken so much action, which is helping a lot. So the first thing we did at Flawless was we started these bi-weekly emails, and it has a section for each age group. So parents and kids, and our interns have to find content that's inspiring for older adults twice a week. And it's been incredible. That's how we found Jacob, actually. So doing work with Flawless, like making sure that we're getting the word out on this issue, is huge. During the crisis, the COVID crisis at my mom's facility was so intense because the staff was getting it. And so I was constantly sending care packages to the staff and to the residents, like twice a week, just constantly going to the post office, sending my mother flowers every week, just really taking a lot of action to make sure I'm staying in touch, calling all of the older adults in my life. My uncle, who lives kind of close, has had some health challenges recently, and I'm extremely involved in his care. I have this Meals on Wheels thing that I do where I bring meals every single week to him and to another older adult. So I'm just taking a lot of action and centering my life in many ways. And I think if we could model this for the younger generation, like Jacob's doing, I think that's where our ticket is with the younger generation.
Like a number of years ago, I was talking about this loneliness, and there were 500 people in the audience, and I asked how many in this audience have ever felt lonely. Only 2 people raised their hand. It wasn't until I shared with them that I have had moments of loneliness, despite the fact that I was CEO of a large company. I have a loving partner, a loving family. I sit on 9 boards. I'm an author of a book. I travel all the time, yet I have experienced loneliness. And once I admitted to that and I was vulnerable, everyone started raising their hand. And so my question to you is, why are we afraid to admit that we have bouts of loneliness? And how do we change it? How do we make this okay to say I'm lonely?
Well, I think it really it's very parallel to what we talk about mental health more broadly, right? And of course, loneliness is not a mental illness. Loneliness is a condition that can contribute to mental illness, right? And but just like with other parts of mental illness, one of the ways that we have started to get ahead of it is to disarm it by talking about it, right? So, we talk about break the silence. And I think that's true of loneliness. I think that's true of racism. I think all of those issues are such that if you start to talk about those issues, you start to wrestle with the root cause issues and then start dealing with it. Talking about it doesn't solve it. I won't say that. I mean, talking about it starts that process, though. And just like with any of those issues, I think, we have two challenges in front of us. One is our personal challenges on how to personally be better at supporting people, personally be better at engaging with people. I think COVID, one of the byproducts of COVID is I have seen, like you have inferred, some people actually come out of their shells and start to engage in ways where the whole neighborhood that I live in, people are talking to each other that never talked to each other before, in part because we need it. We all need it, and it's starting to happen. And I think that's a good practice. But then the other part I would just put on the table is there is a need to think more systemically about how we deal with some of these issues too. That it's not just what you can do as an individual, it's what can we do together in a way that we are more systemically recognizing these issues. And it's hard to figure out how to keep the sincerity that Sheila talks about, the keeping it real at the same time as doing it systemically. But even in the case of the workplace, right, we know that if supervisors or coworkers connect with each other and personally try to make better connections, especially in times like this, it makes a world of difference in how people feel and how you feel. And I think we need to have that type of lens. And then the last point I'll make is that no matter what we do in conditions like this, there are going to be lonely people, there are going to be sick people, people with mental illness. And we need to have a system that backs them up too. And we need to deal with those system issues as well. And so, again, I think there's personalized engagement. I think there's systematically bending improving the conditions of people. And then I think there's also a system that picks people up when they do fall and provides them the support they need when they fall.
Well stated, Mike. You triggered a memory of a great quote. Robert F. Kennedy was famous for quoting from Camus, and one of his favorite quotes was, "Perhaps we live in a world where children are hungry, but perhaps our goal is to lessen the number of children that are hungry." And I think that that's the same thing with loneliness, that perhaps we're going to live in a world where there is loneliness, but our collective efforts is to lessen the number of people who are lonely. Jacob, your passion for this 6 years ago, when loneliness basically wasn't even talked about, and yet we know today that loneliness, the toxic effects of loneliness, is equivalent to smoking 15 cigarettes per day. You don't even have to smoke anymore to feel the impact. I'm interested. You were 13 at the time, and I believe you lost your grandmother at the time, correct? What got you into this, loneliness, position?
I was volunteering at a senior community, and I just saw all the residents. I would sit down with the residents, and they were my friends, and they'd tell me that they hadn't had a visitor in a month, no family, no friends. I was their only visitor as a junior volunteer, and I thought of my own grandma and grandpa, and if they ever told me, they told me if they were alone or felt lonely or isolated, I don't know what I would do. Anyone would do the same thing. You have to do something. And I think it's really interesting, actually, because there was a 2018 study, a national study of adults ages 18 and over by Cigna, which found loneliness in 2018 to be at epidemic levels. Well, now I don't even know where that's at. But in regards to what Mike was saying about what can we do together possibly to support others, I think that at a time when we are all experiencing this pandemic, generosity is what brings people of all races, faiths, political ideologies together and helps sort of dispel those feelings of loneliness across the globe. Just having that ability to like make a positive change in the lives of others, it's a fundamental value that like anyone can act on. And personally for me, generosity and like knowing that I have the power to like give, it's given me control in my life and made me feel more agency and kind of dispelled those feelings of powerlessness that I had at the beginning of the pandemic. And maybe I'm just biased as a nonprofit executive, but I truly do think that giving is the best way, is one of the best ways to fight loneliness with love.
Janine, let me ask you, how do you, in this time of significant change in our society, if I may ask you this, and I hope you're okay with it, how are you handling your mental health, and what are you doing to ensure that holistically you stay healthy?
So I have a very robust self-care practice, and my mental health is my top priority. So I'm lucky that I had that foundation to start with. But this has been very, very, very extreme, the situation that I'm dealing with my mom, and very difficult. So the ways that I'm handling that, I mentioned before, I am, so self-care, number one. Number two, I'm taking action. I'm just grief stricken and heartbroken. And so I'm feeling those feelings sometimes, allowing myself to process that and acknowledging it. And then I'm turning the grief into gold and taking action and creating so much good for older adults and people who are experiencing this loneliness during COVID. I mean, one thanks, Jacob. One time I called to order flowers for my mom at the height of the COVID crisis at her assisted living facility, and I started crying when they asked me her name. I to the woman on the other end, she's like, "What's her name?" I started crying. I couldn't speak. So allowing myself to sit with that, Donato, you and me the other day, I was crying with you. I was so worried about this panel that I'd be crying this whole time, so not denying the grief and taking action to help others. I don't know if you saw, Sheila, I had a good FaceTime with my mom and I put it on Facebook.
Yeah.
There were like over 100 comments and people are really responding. So this is affecting a lot of people.
Yeah.
Others, do you want to? Thank you very much, Janine. And it was interesting. I was so happy Janine reached out to me just a few weeks ago. And it really had that sense that we're all in this together. I think the struggle with COVID-19 is the first time that something's been taken away from us and we're not replacing it with something of equal significance. And I think this is why so many folks are really feeling angry, they're feeling lost, and they're feeling this sense of frustration. But Sheila, anything you want to add to how are you handling your holistic health?
I'd piggyback on everything Janine says. I love you, Janine, and thank you so much for doing it. I'm sad, even for one moment, you had to cry over the preparation for this because it's such a lovely conversation. I really believe, for me personally, that writing has been the therapy that I probably should be paying for. But when this quarantine began, I knew it was going to be really difficult for me because I'm an extrovert. I get my energy from being around people. I had major speeches set up all over the country, and I knew that was going to go away, so that my income was also going to be impacted. And so every day, and I know Facebook is a very lazy way to journal, but I actually talked about what I was going through. And I talked about how difficult it feels to be on top of your emotions and feel like, okay, I know how to do this and I have this self-care routine. And then the next day you're plummeting and you don't even feel as if you want to get out of bed. I became very, very honest about that roller coaster. And in that actually developed a way of kind of watching my own patterns. What was working for me? I found out I need to exercise in the morning. I need to move my body first so that I don't get trapped in social media and a news cycle that just feels so endless. So I do that every day. I meditate first thing rather than getting on social media because I feel like that setting of your brain and just allowing yourself to connect with your breath is probably the most essential thing we can do as human beings. And then every day I do what Janine does. I reach out. I haven't called this friend in a while. I haven't actually taken a social distance walk with this friend. My daughter is dealing with leukemia right now, so I have an extra reason to be really taking quarantine very seriously. And so we don't do a lot of social distance parties. We don't do some of the things that people are doing to actually alleviate some of this stress. But I have found that the added time with her, the added time with her boyfriend, who I might never have been able to know because they were both living very high-paced jobs in San Francisco, I really focus on my blessings. The gratitude practice that I have is really expanded during COVID. And I think that those three things, writing, meditation, mindfulness, moving your body, and a gratitude practice have really saved me.
We have 10 minutes left, and I'd like to throw one question out and have each panelist answer it. The great educator Horace Mann once said, be ashamed to die until you have won some victory for humanity. I love that quote. Each one of you have won more than just a victory for humanity. Can you share how you have gone about doing good, and particularly in the older population? And I'm going to start with you, Jacob. I'm so impressed. This entire group is incredibly impressed with what you are doing at such a young age. And boy, the world is going to be a better place 10, 20, 30, 40, 50 years from now. I won't be alive at that point, but I know that generations will be impacted by what you are doing. What advice can you give to others on how to win these victories for humanity, Jacob?
Gosh, the first thing I would say is I think right now we're seeing CSR departments, we're seeing individuals do a lot of remote volunteering and a lot of just like remote, like embracing others. And I think as much as possible, even in this totally new virtual space that we didn't know we were prepared for, and we're still kind of, we're definitely still adjusting to, I think we need to focus on like acting together as much as we can. When we were talking about the like politics of like how can we support like older Americans right now, older adults, I think one of the best things we can do as individuals is make sure that we are we're like supporting them in our personal lives, and also making sure that we are donating to organizations that serve communities that are being affected right now. When you think about the last cause that you gave to, your local arts institution or sports organization might come to mind. And in 2014, only 1 in 10 donors self-reported contributing to organizations that help our elders. And this can be compared to half of these donors supporting places of worship and a quarter supporting animal protection organizations. And what's worse, 55% of Americans reported making charitable contributions at all. I think that our elders deserve better. And I think that we can all make sure that we are determined to foster giving and making sure that our elders do feel supported, because obviously supporting seniors and serving seniors is such an important cause, especially now. I think that's all tied into ageism and what like Sheila was talking about. I think there's a huge stigma around mental health, and I think we all can do better with our own mental health practices. I'm so happy that you have like a gratitude practice. I've been trying to incorporate one into my daily routine, but it's hard. And I think like EQ over IQ, like we should all be focusing on our emotions and our mental health right now. And I think even online, a lot of us are getting, I shouldn't speak for everyone. I personally have been feeling very overworked and overwhelmed. And I think we all just need to take a step back and also try to think about how we are thinking about others. Are we having these like dialogues of like how ageism is playing into the pandemic and how it's making us think about other people and how it's affecting our empathy, and what can we do for others? I just think that I think that everyone wants to give right now. And I just think we need to listen to senior communities. We need to listen to senior care workers. We need to listen to essential workers and people on the front lines and figure out what they need. So making sure that we are giving effectively, giving enough, and supporting in any way we can. And I think we've seen communities on small scales do that. And also I think a lot of companies right now are really trying to ramp up how they can support their employees in giving. That's been a beautiful thing for me to see in all these companies, like coming to my nonprofit and deciding like, yeah, like we want to give to seniors. That's something we've never done before. And this is an awesome opportunity to just write a letter to seniors, make a little video, write a story to fight ageism and share the stories of our unsung heroes. So it's been really beautiful to be here today and like listen to all of you like share the awesome things you're doing, what you're experiencing. So thank you.
Jacob, I know you're not old enough, but I'm going to write your name in November. Janine, how do we help others recognize victories?
So putting this issue on the table and being loud and proud about it. That's part, that's so much of what we do at Flawless. So we've been writing about this issue for years. We've been, how many rural aging summits have I been to with you, Donato? Right? Really looking at this issue in a systemic way and focusing attention on it. And I think that people our age need to be modeling for people. Jacob's a star, but I'm very concerned about kids Jacob's age, and they don't live near their grandparents anymore. They don't have relationships with their grandparents. I'm very, very concerned about that because I think that's what's going to affect things systemically. Choosing to go into the field of working with older adults. All of these issues are going to come from, we're starting to see the cracks in the system from the change in our demographic and the way our world has become more spread out. And so taking action, giving, service being a top priority and value, and modeling for others in our action.
Modeling, very key word. Mike.
When I think about this, I think in terms of, it's almost a selfish endeavor when you think that your own well-being is optimized when you feel good about what you've done for others, right? And so it is not, this is not all altruism. At some level, it's what makes our lives better. It makes our lives purposeful, supports our well-being. And that's especially important at a time like this with COVID-19. I think the more that you can look yourself in the mirror and feel good about what you're doing and helping people, the easier it is for you to cope in an environment that otherwise is compromised. And then the question is how, what is it that I should focus on? What is it that I should do? And I listen to the people on the panel and I say, boy, these are a lot of talented people with a lot of different assets. And I always think that it's an issue of best use. What is it that I can do that others can't? And if I do it, it'll actually make a difference in people's lives. Mm-hmm. And I'm in a position that I can do some of those things. And because of that, those are the things I prioritize, the things that I can do, and maybe others can't because they're not in my position. They don't necessarily have my skill set, and I don't have theirs or their position either. And so I respect how others contribute, and I try to take advantage on how I can uniquely do so. And I do that for them, but I do it for me too, because I feel better at the end of the day being able to look myself in the mirror and say, yeah, I made a difference. That's good.
You're an amazing person, Mike. Well stated. Sheila.
The only thing, and we could close it there because all of these things are so beautiful, but I love what Mike has suggested is that if we get quiet with ourselves about what it is that our unique talents are, there's going to be an epiphany for us about how we can give effectively. And for me personally, I lost my husband 12 years ago to suicide, and it changed my life. Overnight, I became a person who wasn't so interested in delivering the news. I was interested in delivering information about mental health. And I still believe that that is my one gift, is that I'm a good communicator. I know how to write. I know how to broadcast. And so we're providing a free podcast to young people to give them these kind of emotional tools for coping at Beyond Well. And further, we're actually working with corporate leaders to say how important this is to have this conversation in your workplace, to have a workforce, even if it's remote, who knows how to get the tools for being able to live better through this terrible journey that we're all experiencing together, and through the best times as well. And I would just also say, in terms of the changes that Mike outlined, the systemic changes, never be afraid to call the very top. I have spoken to the assisted living corporate leader where my mom was about the importance of bringing mental health into their thinking around COVID, along with physical health. We have to be the advocates for the people who don't have voices during this time, whether it's with a microphone or just over the telephone or a well-written email. Be that advocate for people.
Well said. In the minute that is remaining, I first want to thank all of you for the great conversation. You never know when you get on these panels. You know, you have not met the folks before, but I have to tell you, this was just awesome. There are three things that never come back, I always say: the spoken word, the past, and a missed opportunity. We didn't know each other, at least I did not know most of you here today, and I hope that we don't miss this opportunity to do four things: to increase our connections, not only just with those who we know, but those who we don't know. I have started months ago, when I'm in the grocery store, to thank people who I don't even know if they're wearing their mask, or a grocery store worker who came in because, you know, she needs the job or he needs the job, and yet they're putting their lives out there in this significant pandemic. Number two, take care of yourselves. We have to make sure that we are holistically sound, mentally, physically, spiritually. Third, let's recognize loneliness, and let's put the issue out there, and let's recognize the various dimensions of how stories matter. All of you had unique stories today, and I don't know how you felt, but that's what really got me connected to you all, by being vulnerable and sharing your story. And last but not least, let's be kind, let's be compassionate, and let's be supportive. I always end my conversations and my emails by saying, make it a great day, not have a great day. So to all of you, make it a great journey. And Janine, thank you for connecting all of us. And I will unquestionably be following up with each and every one of you. Thank you.